I've always found it striking how the phrase psychological disorder gets tossed around. But when you dig deeper, it's about so much more than a label. We're really talking about conditions that impact how people think, feel, and even behave sometimes, making daily life way harder than it needs to be.
Absolutely. And what stands out to me is how broad that spectrum is. You've got everything from mild anxiety or stress, all the way to severe challenges like schizophrenia. It's this huge range, and it's not just about the person's mood, it can touch every part of their life, from work to relationships.
And that's exactly why classifying these conditions is so crucial. Imagine trying to treat someone without any kind of system for understanding what they're going through, total chaos. That's where the DSM-5 and ICD systems come in, right?
Yeah, those two are the backbone for diagnosis in mental health care. They help everyone. Doctors, therapists, researchers speak the same language. But, they each have their quirks. The DSM-5 is sort of the go-to in the US, while the ICD is more global. Let's unpack how they actually work.
So, I'm curious, what's your take on how these manuals are structured? I know DSM-5 is really detailed, but ICD is broader, right?
That's the gist of it. DSM-5, which the American Psychiatric Association puts out, gives clinicians a deep dive into symptom lists and criteria for each disorder, like, for depression, you need at least 5 symptoms over 2 weeks. It's very checklist-oriented.
Meanwhile, the ICD, from the World Health Organization, covers everything physical and mental health, so it uses codes to keep things streamlined. That seems helpful for global research or insurance, but maybe a bit less detailed for day-to-day therapy.
Exactly. And one thing I appreciate about ICD-11 is its effort to reflect cultural differences. Mental health doesn't look the same in every country, so the ICD tries to leave space for that. But, let's be honest, these categories aren't always clear-cut. Even professionals run into grey areas fairly often.
Yeah, the overlap between symptoms can get messy. Speaking of which, have you ever noticed how often people experience more than one disorder at once? That whole comorbidity thing.
For sure. It's so common for someone to have, say, anxiety and depression together, or even something like OCD mixed with depressive symptoms. The manuals have guidelines for this, but in reality, it's not always obvious, which is the core issue.
That actually reminds me of a client I once worked with who had symptoms that fit both PTSD and generalized anxiety. It took a lot of digging to tease apart what was fueling what. And I think that's where those dimensional assessments in DSM-5 are helpful. They look at symptom severity, not just yes or no.
Absolutely. And it reflects real life more accurately. Most people don't fit into neat boxes. There's also that argument that maybe our field should move away from rigid labels and start thinking in terms of spectrums of mental health instead.
Right, especially now that we're learning more about genetics and brain biology. Speaking of which, how do you see treatments changing as we get more tech and science involved?
It's wild how fast things are moving. On one hand, we've got classic treatments like cognitive behavioral therapy, antidepressants, or mood stabilizers. But now, you've got virtual reality for phobias, AI-driven mental health apps, and even research into psychedelics for depression or PTSD.
And let's not forget about wearables and sleep tracking. Those can flag mood changes before someone even realizes it themselves. I know a few therapists who use data from clients' apps to tailor their sessions. That's a huge shift from the old days of just talk therapy.
Definitely. Plus, with teletherapy, people in remote areas or even different countries can get help. It's not perfect, there are privacy and access concerns, but it's a step toward making care more available. Still, I think technology is only part of the puzzle. Social support, lifestyle changes, all of that still matters.
For sure. And on top of tech, we're seeing more personalized care, like genetic testing to predict medication response. The future's looking pretty tailored, but also more complex, which makes me wonder, what about the barriers people still face, like stigma and access?
That's a huge hurdle. Even with all these advances, stigma still keeps people from reaching out. And in some cultures, talking about mental health is almost taboo, which leads to a lot of suffering and silence.
Exactly. I've seen workplaces where mental health days are available on paper, but people are nervous to use them, or families that downplay depression as just laziness. Breaking that cycle takes a lot of education and honest conversation.
And global access is another piece. In many low-income countries, there just aren't enough professionals or resources. Digital tools are helping, but we need policies and funding that prioritize mental health as much as physical health.
I totally agree. The more we normalize mental health talk, support early intervention, and improve access, the better shot we have at helping people lead full, healthy lives. Maybe in the next decade, mental health will finally get the attention it deserves both scientifically and socially.
Here's hoping. If nothing else, it's an exciting time to be working in this field. There are challenges, but also so many opportunities to make real change.
Looking back, it's incredible how far we've come in understanding and treating psychological disorders, but it's clear there's still a journey ahead. I love how new tools and fresh perspectives are opening doors, but at the end of the day, empathy and human connection are still at the heart of mental health care.
Couldn't agree more. Whether it's updating our manuals, breaking down stigma, or embracing technology, the goal stays the same: helping people live their best, healthiest lives. Here's to keeping the conversation going and supporting each other along the way.